Hello everyone, and welcome to this demonstration video by me, student nurse Precioso Cruz from the Pamantasan ng Lungsod ng Maynila. Today, I'm going to demonstrate how to do nasopharyngeal and oropharyngeal suctioning. So firstly, we prepare the equipment. Preparing beforehand would ensure that no equipment would be left behind and the procedure would be done continuously. Here are the equipment to be used. We have the suction machine, suction catheter, which is the adult size is 14 to 16 while PEDJA is 8 to 12, sterile gloves, sterile water, linen saver, tongue depressor, and our personal protective equipment. Next, we check for the doctor's written order for suctioning. Checking if written order is present would give the nurse a heads up to the patient's status and lets the nurse prepare for the suctioning. Next, we assess the client's respiratory status such as the character and the breath sounds. Assess for chest sounds and audible secretion during respiration. Assessment would provide the nurse information about the patient to determine the need for further or immediate suctioning. Next is we perform hand hygiene. Suctioning must be a sterile procedure to prevent microorganism transfer to the patient. Thus, proper hand hygiene and proper hand washing is needed. Then, we organize all needed materials. An organized workplace before procedures must be done to prevent unnecessary movements and prevent accidents. Before any procedure, patient identification must be done to prevent wrong patient accidents. Identifying the patient by name would help nurse assess neurologic status. Explaining the procedure would decrease anxiety and make the patient cooperative. Lowering of the side rails would reduce the strain on nurse and provides accessibility to the patient. A conscious patient is positioned in a semi-fowler position to prevent aspiration and promote lung expansion. If unconscious, a side-lying position with the head facing to the side would aid in expulsion of secretions, thus preventing aspiration. This also prevents accidental trauma to the tongue as it would slip out through gravity. Then, we place a clean towel or drape on the client's chin. This would prevent secretions from touching the skin, which would prevent microbial growth. We set the pressure on the suction gauge, turn on the suction, and place the thumb over the end of the suction tubing. Pressure must be at the minimum to prevent mucosal trauma and adherence. Placing the thumb over the end of the suction tubing gives the nurse more control over the suction tubing. We put on sterile gloves. Reserve the sterile glove on your dominant hand for contact with the suction catheter and use the non-dominant hand with the tubing. Sterility of the dominant hand must be maintained to prevent microbial transfer to the suction catheter and to the mucosa of the patient. Hold the suction catheter in the sterile non-dominant hand and attach the suction control port tubing of suction source held in the non-sterile non-dominant hand. The port and the suction source are unsterile, that is why the non-dominant hand must be used to connect the suction equipment. Suction tubing must also be wrapped partially around the hand to gain control. Lubricate 3 to 4 inches of the catheter tip with irrigating solution. Lubrication pre-procedure would loosen secretions and reduce the friction, which promotes mucosal adherence, which would lead to trauma. Insert the catheter through the unobstructed nostril of the nose using a slanted downward motion. Be sure finger is not covering the opening part of the port. Directing the catheter along the side prevents gagging. The nasal cavity points downward, thus pointing the catheter downwards would prevent nasal trauma and mucosal trauma and irritation. Through the mouth, you may use a tongue depressor. Slide the catheter along the side of the mouth to the oropharynx until the client coughs or resistance is felt. So sliding through the side of the mouth and feeling of resistance and coughing would provide the nurse an idea up until where to suction to prevent injury. Holding your thumb over the opening of the catheter, apply suction for 5 to 10 seconds with a maximum of 15 seconds. 5 to 10 seconds is allowed to prevent vagal stimulation too much which causes bradycardia, hypotension, and hypoxemia. Then, withdraw the catheter slowly while applying suction and rotating the catheter between the fingers. Intermittent suctioning would prevent further vagal stimulation as well as further irritation of the lining, which would produce more and more secretions. Place the tip of the suction catheter in sterile solution and apply for 1 to 2 seconds. Relubrication and resuctioning for a minimal time would ensure the loosening and expulsion of secretions from the catheter itself. Encourage the client to do deep breathing exercises and to cough between suctioning. Breathing deeply and coughing promotes proper lung expulsion as well as the loosening and expulsion of secretions from the tracheobronchial tree. Too long of suctioning, more than cumulative of 5 minutes and more than 20 to 30 seconds between suctioning would cause vagal stimulation, which would result in bradycardia and hypoxemia. Also, irritation would occur in the mucosa, which would cause further productions of secretions. Here, I also assess the patient's breath sounds to determine the need for further suctioning before proceeding to the next steps to promote efficiency. We then turn off the suction source using the non-dominant hand. The dominant hand is the dirtier hand as it may be harboring secretions, thus the non-dominant hand is used to turn off the suction source to prevent microbial transmission. Disconnect the suction catheter from the suction tubing. This connection would let the nurse clean the tubing and to prevent microbial transfer from the tubing to the source. Also, using the non-dominant hand, pull the cuff of the sterile glove catheter in the gloved hand. So, this would have the catheter immediately wrapped in the glove, which would prevent microorganism transfer. We then position the patient for support and provide him or her oral and nasal care. Positions such as the semi-Fowler's position would promote lung expansion for a conscious patient, while a lateral recumbent would promote secretion expulsion for the unconscious patient. Also, the nasal and oral care is to prevent infections of the oral and nasal cavity, which was soaked in secretions prior. We then discard the equipment appropriately. This is to prevent microbial transmission. We then again wash hands and perform proper hand hygiene. This is to prevent microbial transmission. Also, the rule that after interacting with the patient or touching the patient or having to touch secretions of the patient, we must do proper hand hygiene to prevent microbial transmission. Lastly, we record the procedure. Evaluate the client's character of respiration after suctioning. Evaluate the client's tolerance in the procedure. Evaluate the color, amount, and consistency of secretions. Record the client's tolerance and response to the procedure. Document the color, amount, and consistency of the secretion. Reassessment of the patient would tell the nurse whether the patient needs further interventions such as suctioning, chest physiotherapy, oxygenation, and more. Also, this would also help healthcare providers to formulate further plans to improve the patient's condition.